Femarians, this is Michelle Pang. We have Ali Hat for the men, and now it is my pleasure to share with you an amazing product for women by Emery, Plus Femmetima. It is a natural approach to women's health. Before we zoom into the benefit of this product, let us first understand the function of the female sex hormones. The female sex hormone play an important role in maintaining a woman's health. Hormones basically are chemical messengers that the endocrine glands produce and release into the bloodstream and acts everywhere in the body. In females, the ovaries and the adrenal glands are the main producers of sex hormones. Female sex hormones include estrogen, progesterone, and small quantity of testosterone. Let us first look at estrogen. Estrogen is mainly produced by the ovaries and the adrenal glands. Estrogen helps bring about the physical changes that turns a girl into a woman during puberty. These changes include growth of the breast, growth of pubic and underarm hair, start of menstrual cycles, and most importantly, estrogen helps control the menstrual cycle and is essential for childbearing. Estrogen also has other functions which include keeping cholesterol in control, protecting bone health for women, and it affects our mood, heart, skin, and other tissues in our body. The second female sex hormone is progesterone. This hormone is produced by the ovaries, adrenal glands, and placenta. Progesterone levels increase during ovulation and spike during pregnancy. Progesterone helps stabilize menstrual cycle and prepares the body for pregnancy. The third female sex hormone is testosterone. Although testosterone is the main sex hormone in males, it is also present in lower amounts in females. In females, testosterone affects fertility, sexual desire, menstruation, tissue and bone mass, and red blood cells production. Aside from sexual development and reproduction, this female sex hormone also involves in regulating bone and muscle growth, inflammatory responses, regulating cholesterol levels, promote hair growth, and body fat distribution. Our hormone fluctuates due to several factors. The first factor, age. As we move through the stages of life, levels of most hormones decreased with aging. The most significant changes happen during puberty, pregnancy, and menopause. Let's zoom into puberty. Puberty most often starts at the age of 9 to 14. This is the time when a part of the brain called the hypothalamus begins to produce a hormone that has an effect on the ovaries, causing an increase in estrogen in girls that brings about physical changes and marks the start of menstruation. The second factor, pregnancy. Pregnant women experience sudden and dramatic increase in estrogen and progesterone. The third factor, stress. Chronic stress affects the concentration of all sex hormones because the body produces stress hormones such as cortisol and adrenaline at the expense of sex hormones. In order to fight stress, our body shuts down sex mechanisms so that we are better able to deal with more urgent and immediate needs. If you frequently face challenges, your body is constantly producing high levels of stress hormones. Over time, it can cause serious health problems, including stomach pain, weight gain, weakened immunity, anxiety, depression, loss of sleep, and heart disease. The fourth factor, menstruation. The menstrual cycle is regulated by hormones. Luteinizing hormones and follicle-stimulating hormones, which are produced by the pituitary gland, promote ovulation and stimulate the ovaries to produce estrogen and progesterone. Estrogen and progesterone stimulate the uterus and the breast to prepare for possible fertilization. If you do not get pregnant, estrogen and progesterone hormone levels begin falling. Very low levels of estrogen and progesterone tells your body to begin menstruation. The fifth factor, menopause. Menopause occurs most often after the age of 45. It is the time when women's ovaries begin producing decreasing amount of estrogen and progesterone. The changes of hormone level causes the body to experience menopausal symptoms such as hot flushes or night sweats, trouble sleeping, vaginal dryness, mood swings, trouble focusing, and so on. And lastly, medication. Some drugs or medication like cocaine, antidepressant, and steroid affects mood, sexual, and cognitive function. Although hormonal levels fluctuate, long-term imbalance with too little or too much of certain hormones can lead to a number of symptoms and conditions. These include anxiety, foggy thinking, irritability and irregular mood changes, fatigue, food cravings, weight gain, night sweats, increased susceptibility to infection, irregular periods, hot flushes, headache, depression, excess body and facial hair, acne, vaginal dryness, low sex drive, breast tenderness, gastrointestinal problems, and difficulty sleeping. From the list of signs and symptoms of hormonal imbalance, you may see the similarity to the symptoms of aging. Study shows that a decrease in anabolic hormones, which include estrogen and growth hormone, leads to the decline in physical function. Through the understanding on what women need to stay youthful, healthy, and vibrant, this is why Emery launched this amazing product specially for women. Introducing our natural anti-aging product for modern-day women, Emer Plus Femmetima. It is specially formulated to maintain the delicate balance of the female hormones, thus helping to reduce the signs of aging among women. The main ingredient of Emer Plus Femmetima is Kachip-Fatima. Kachip-Fatima is rich in phytoestrogen and isoflavones, and they are plant-derived compounds with estrogenic activities. Scientific studies found that the biological activities of Kachip-Fatima are due to the presence of phytoestrogen or plant estrogen that is naturally found in Kachip-Fatima. Kachip-Fatima is traditionally used to maintain a healthy female reproductive system and to help to enhance sexual function. It helps to tighten and lubricate the vagina. It helps to induce and facilitate childbirth, firm the abdominal muscles, regain body strength, regulate menstrual cycle, helps to alleviate menopausal symptoms, and helps in dysentery and rheumatism. So what are the uniqueness of Emer Plus Femmetima? The main ingredient in Femmetima, which is Kachip-Fatima, is originally from Malaysia rainforest that comes with the highest active ingredients. Secondly, scientifically proven efficacy. Studies have been carried out on the efficacy of Kachip-Fatima. From this study, it shows that Kachip-Fatima helps in regulating hormones, reducing postmenopausal cardiovascular risk, protecting the skin from UVB irradiation. It helps to increase the production of collagen in the skin and preventing postmenopausal osteoporosis by increasing bone calcium. Third, freeze-dry powder. Through the freeze-dry technique, it helps to preserve most of the initial raw materials properties such as smell, taste, and color. It causes less damage to the substance than other dehydration methods using higher temperature. Fourth, it is natural and safe. Kachip-Fatima has been traditionally used by Malay women for many generations. And lastly, Femmetima is suitable for healthy women, women with hormonal imbalance, and postmenopausal women. The benefit of Emer Plus Femmetima include it helps to maintain a healthy female reproductive system, regulate menstrual cycle, it helps to tighten and lubricate the vagina, it helps to enhance sexual function, regain body strength, it helps to alleviate menopausal symptoms, reduce postmenopausal cardiovascular risk, prevent postmenopausal osteoporosis, and protect the skin from UVB irradiation. The daily recommended dosage of Emer Plus Femmetima is 2 capsules per day after meal. As Femmetima is a herbal product, it is advisable to follow the recommended dosage. Femmetima works hand in hand with Virgin to further enhance the health of the female reproductive system. And here you go with my sharing on Emer Plus Femmetima. Stay happy, stay healthy. Thank you, and I'll see you in my next training.